mynews.studio.
A surgeon in China stands there, holding up a kidney that was once labeled type A. It's now marked as universal O. But the real question is, will regulators and, maybe more importantly, the immune system actually agree it's suitable for anyone?
Today is October 25th, 2025. Let's start with the core event. Scientists from Canada and China have managed to enzymatically convert a donated kidney from blood type A to type O and then transplant it into a human. This is the first time an organ has been changed to universal status and used in a transplant.
Exactly, and the specifics are worth unpacking. The kidney was transplanted into a brain-dead recipient with the family's permission in Chongqing. They chose this approach so they could monitor immune reactions in a human body, but without putting a living patient at risk. For 2 days, the organ didn't show hyperacute rejection. That's usually the immune system's most rapid and severe response.
But then on day 3, some of those original blood type markers actually reappeared on the kidney, didn't they? That seems like a possible setback.
It is a concern, but when you compare it to standard mismatched transplants, the immune response here was actually mild. The kidney kept working for 6 days. The main breakthrough is that the enzyme treatment removed the A antigens on the blood vessels. That's what usually triggers the immune attack. If those antigens start coming back, the method might need more refinement, but it's already a major step forward compared to current approaches.
Is this the same enzyme process that's been used for universal donor blood, or is it different for organs?
The research actually started with blood. In 2019, scientists at the University of British Columbia found enzymes that could strip away the sugars defining blood type from red blood cells. It turns out, those same sugars are also present on the blood vessels of organs. So by treating the organ with the same enzymes, you can, at least in theory, make any organ universally compatible.
So why is this such a big deal right now? Is it just about having more organs available, or does it actually change how organs are allocated?
It's both. There's a persistent mismatch between patients waiting for organs and the types available. Type O patients really struggle. They wait the longest because their blood type is the most restrictive. But ironically, type O kidneys are given to lots of recipients because they're considered universal, which pushes O patients even further back in line.
So if every donated kidney could be converted to type O, the allocation system would have to change. How would that look in practice?
Blood type could stop being the main factor in matching donors and recipients. Instead, the system could focus more on urgency, how long someone has been waiting, and tissue compatibility. But that would mean updating regulations and policies and ensuring the system stays fair for everyone.
And in terms of approval, agencies like the FDA or EMA will probably require several phases of clinical trials. What will they be looking for before giving a green light?
Their top concern is safety. No severe or unexpected immune reactions, no catastrophic rejections. They'll also need evidence that the enzyme treatment remains stable over time and works across a wide range of patients, not just in one hospital or country. Long-term survival of the organ will be another key metric.
On the ethics side, using brain-dead recipients isn't typical in organ transplant studies. Is there any controversy around that approach?
It's a model that's been used before, especially in xenotransplant research. It helps bridge the gap between preclinical studies and human trials while reducing risk. But transparency and fully informed consent are crucial. And since regulations vary by country, global adoption could move at different speeds.
If the technology proves reliable, could it be used for other organs too, not just kidneys?
Actually, the team managed to convert a lung to type O back in 2022, though it wasn't transplanted. In principle, the enzymes should work on any organ where blood type antigens cause issues. That could really transform the whole field of transplantation.
But there's that challenge we mentioned earlier. The blood type markers started reappearing after a few days. Does that increase the risk of long-term rejection?
It's definitely something researchers are focusing on. They're aiming to refine the enzyme process to slow or prevent that regrowth. More trials, especially with living patients, will show whether the conversion can last and if the immune system stays tolerant over the longer term.
There's another layer to this: equity. Could this technology really make transplants more accessible for everyone? Or could it create new hurdles?
Ideally, it would reduce disparities, less weighting based on blood type, and more options for all patients. But if access to the technology is limited to wealthy hospitals or countries, the gap could actually get worse. So, updating allocation policies and investing in infrastructure will be just as important as the science itself.
So we're really at the beginning of what could be a fundamental change in transplant medicine. What's next on the horizon?
The next steps are more clinical trials, regulatory review, and international collaboration to set shared standards. Researchers also need to keep improving the enzyme treatments and watch for any unexpected complications. The ultimate goal is simple: any kidney, any blood type, any patient.
If this works, it could mean the end of blood type barriers in organ donation. That would be a major shift in global health.
It's science finally meeting a basic human need. Millions of people are waiting for transplants, and this breakthrough could offer hope where there was none before.
To recap, scientists have enzymatically turned a kidney into a universal type O organ, transplanted it successfully in a human model, and opened up a new path toward global transplant equity. The next chapters will be written by clinical trials, regulatory decisions, and careful ethical review.
That image, a once unmatched organ, now potentially ready for anyone. If it's validated, it really does change everything.
Thanks for listening. This episode is powered by mynews.studio. You can try it now for free.